Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Welcome, everybody. We're excited to have all of you here with us today. My name is Ashley Ellis, and I am an assistant dean here at the College of Pharmacy for Strategic Partnerships and Innovation, and I work on the Population Health Consortium and the Tennessee Heart Health Network to help practices integrate pharmacists and health coaches into their business models. And I am really trying to take the lead here on our learning collaboratives and our updates that we'll be having over the next year and into the next 5 years of our projects here being funded by the CDC. So I am happy to have all of you here. And I see a few more people are joining us, so welcome, welcome, welcome. Our speaker today is Dr. Susan Butterworth. She's an associate professor here, and she's the director for patient engagement and has a large area of expertise for us. She really works in motivational interviewing and on the health coach side. I'm going to let her introduce herself a bit more and take it away. And Susan, please let me know if you need anything on the technical assistance side. I will also be monitoring the chat for any questions, so please feel free to ask them there.
Great, thank you, Ashley, and good afternoon, everyone. So glad to have you join and participate in our learning collaborative. Going forward, if you would like to pass along the registration to these learning collaboratives to any of your colleagues, I'm going to ask Brandy Bledsoe to put her email in the chat. So feel free to invite any of your colleagues. This is an open forum. We specialize in assisting practitioners, both clinical and non-clinical in the state of Tennessee, but other people are definitely most welcome. I'm going to go ahead and share my screen. So today we want to talk a little bit about our health coach certification program. And we want to look at the benefits of trying to integrate evidence-based health coaching into a clinical practice. We want to describe the role and function typically of a health coach. We're definitely going to cover the value of motivational interviewing as our primary communication approach. We'll talk about how to build a skill set, and we'll definitely go into some details about the health coach certification program. But I'm most excited that we have a couple of practitioners with us today who are going to share their experiences of getting the health coach certification and how they've used it in their practice. And I hope to also have some of you on the call also share with us how you have been using your health coaching strategies and skills in your own practice. So I want to start with a question for you, and if, feel free to use the chat function. I'd like to know what you feel the main barriers and challenges are of meeting health-related goals. I'm going to throw you a curveball, and rather than looking through the eyes of a patient, I'd like you to look through the eyes of yourself, your own perspective. I think most of us have lifestyle-related goals and changes that we'd like to make, and it's not easy. So if you use the chat function, what are just a couple of your top, what you would consider a couple of your top challenges? And I'm going to ask Ashley to kind of read out what is going into that chat.
Okay, we've got a couple. Ooh, we got a bunch coming in. Okay, so we've got motivation, time constraints, busy schedules. We've got another one, motivation.
Terrific. And I'll give everyone a couple more seconds to add.
We had another one come in, which was correct information. I think that's a big one too, with a lot of medical misinformation out there now.
And as we're thinking through our own lens, obviously too, what I'd like you to do is, to think about our own patients who may have busier lives, more overwhelmed lives, social risks, and how tough it is for them as well. And so if we look at our word cloud here, we can see that, we think a lot of times in patient education, oh, it's all about knowledge. But it really isn't. Not that knowledge can't help and skills, but we're really looking at empowerment and motivation and sense of agency, that what I do matters, self-efficacy, my confidence. People talked about barriers such as time. And then again, we've got the social determinants of health. And so there's all kinds of barriers and challenges, which doesn't mean that this isn't something that we can't help ourselves and people to do, but it's not as simple as it can be in medicine that says, take this medication and your symptoms will go away. Yeah, especially depending on where we're getting our information, that also can be very confusing for people as well. So I've got one more quick question for you. Do you consider yourself a health coach? Just without overthinking that too much, if you'll use your thumbs up. Does everybody see where you can do a thumbs up or thumbs down? If you can just put or you could just do it right there if you're on camera for sure. So if you consider yourself a health coach, if you'll give us a thumbs up, and you can do a thumbs down if you want. So we're seeing a few thumbs up for sure, but we're not seeing everyone. And I want to explore that just a little bit. So
I see 4 or 5 thumbs up. I've got 3 in the chat, and I've got one that says I'm still trading.
There you go. So if we want to look at what exactly health coaching is, we may even change our response, because if you may not be a health coach per se, that might not be your title, but if you're using your communication skills and strategies to try to engage and guide patients towards any type of targeted health goal, it could be a health behavior change, adherence to a treatment plan, helping to manage a chronic condition, even just following through on a referral. If you're doing that, then you are doing health coaching. And so I'm so glad that you're interested in here today, because you may be interested in developing your skill set. Again, you may not be called health coach, but it's a skill that most every clinician and practitioner is being called on to do in our day of this chronic condition and lifestyle management need. So the role of a health coach right now is to apply communication skills and strategies. We want them to engage patients, increase motivation to make that change. We need to help patients identify and achieve goals regarding chronic conditions or lifestyle management. And then we want to empower patients to address self-efficacy or confidence and their sense of agency for managing health and navigating the health system. And as we all know, in terms of either for ourselves or loved ones, even when we're in healthcare, it can be really hard to advocate for ourselves in the healthcare system today. A really important foundation of health coaching is the concept of patient activation, which was coined by Judy Hibbard. She was a colleague of mine when I was in Oregon. And we all know that knowledge and skills are important, but we really have to activate people first. If they don't feel empowered to take charge of their health, if they don't feel like they can, if they don't feel their efforts make a difference, it doesn't matter what knowledge and skills we give them. So this Chinese proverb is just so apt. Give a man a fish and you feed him for a day, teach him to fish and you feed him for a lifetime. So as health coaches, we really want to help teach people how to fish. And this is going to involve problem solving, learning how to recognize patterns, and developing insights. You can see here that this doc is flipping a coin, and he says, heads, you get a quadruple bypass, tails, you take baby aspirin. Well, obviously in medicine, we use best practice guidelines for diagnosing and treatment. And so when we're talking about patient engagement and health coaching, we also want to identify and use best practice. The traditional medical model is now outdated. For acute medical care, this works, but not in the chronic care management world. Ostensibly, we tell patients what to do. We tell them how to do it, why to do it, and then they'll just go about their business and follow our instructions and make it happen, right? We know that's not usually how it goes. This is hard. And so in a patient-centered mode, we're going to take a much more sophisticated approach. We're going to build rapport, express empathy, validate barriers. We're going to elicit the patient's narrative. And most importantly, we're going to evoke change talk. What we hope is that patients will become activated. They're going to follow through on their treatment plan. They're going to be able to successfully navigate the healthcare system and feel confident about doing that. And then ultimately, we want them to be more engaged so that they can be successful in managing a chronic condition or making a lifestyle change. Health coaches focus on patient needs, and they address constructs that help people identify and meet their behavior change goal. So you can see there's a lot here. Some of my favorites are ones that you may not think about, such as resiliency, social support, learning how to take feedback, learning how to be self-aware, being aware of the resources around us. So these are some of the things that health coaches can help with patients. I'm not going to go into a comprehensive review of the literature, but I did want to share just a few of research and clinical practice where health coaching was used and successfully used. In this cluster randomized trial, it was in the South, it was in Louisiana, called Propel, and it was, they either had usual care or they had their weight loss program. And as part of weight loss, they were also talking about, exercise and healthy eating and making smart choices. It wasn't just about losing weight. And it was a 2-year program, and they measured the progress for not just 1 year, but also at the end of the second year, which is really helpful because it's, as we know, it's kind of easy to make changes for a few months. It's hard to maintain them. In terms of the outcome, they did lose significant amount of weight over the usual care group. Their fasting glucose decreased, which is important at 12 months, but not at the 24. They did have increases in their HDL cholesterol, and also their total HDL ratio and metabolic syndrome severity decreased in the treatment group at both time points. So that's fantastic. This is the reference if you want to go back and look at this trial yourself. I was fortunate enough to be part of the model study with our own Dr. Jim Bailey as PI here at UT. It was a large clinical trial. We randomized people to 3 different arms. So there were really 3 intervention arms. The usual care received enhanced material. We had a health coaching arm and a motivational text message arm. I'm just going to give you the outcomes, kind of focusing on the health coaching arm. All 3 arms improved diet, exercise, and A1C. Only the health coaching arm was effective in reducing the BMI significantly, and that's because that was the #1 health topic that was discussed in the health coaching, where the other 2 arms covered a lot of different topics. Self-reported medication adherence improved among all 3 arms, and self-efficacy or confidence did improve in the health coaching and motivational text messaging arms. Again, here's a URL at the very end if you'd like to kind of look more deeply into this study. Lastly, this is a pilot study. It was small, but I thought it was really interesting because it involved community pharmacist-led health coaching on clinical outcomes. And so it was just 42 members. They had almost 3 disease states, and the number of medications was significantly decreased. Blood pressure, both diastolic and systolic, went down. A1C, weight, LDL, HDL, triglycerides, depression severity, these were all improved, even though they did not reach significance. So this was a pilot study, and they're going to do a clinical trial. And again, here's your reference.
Susan, we had another question
Sure.
on clinical or on the trial before. Just to clarify, so on the text messaging intervention, Did it work or did it not work?
Yeah, we had extremely good results from our text messaging. In fact, if you look at the results from all three arms, our text messaging probably had the most significant outcomes, and these were motivational text messages. So you can see this is a form of health coaching. One of the things I've always advocated is not this or that, but if we can use a variety of modalities to reach people. And also by choice, do they want health coaching? Do they like, websites provided? Do they want text messages? Let's give people what they want. But this particular study showed that even just using enhanced materials was helpful. So anything that kind of enhanced usual care. And again, this was a clinical trial to kind of, really pick out what was effective, but in a real life situation, we like to use them all. And we do advise clinics to do that, to try that if they can. For community health workers, do a lot of health coaching, and we separate them out, but I would be remiss if I didn't mention just there is a lot of very good research and outcomes with community health worker. This is an impact program from Penn. University of Pennsylvania, and they showed improved access to healthcare services, increased health and screening, better understanding between the community and the health and the community members and the systems in which they have to navigate, enhanced communication, which is important, and increased use of healthcare services, and improved adherence to health recommendations. So also, they reduced their need for emergency and specialty services, which was huge. So again, we're talking about health coaches, but community health workers, there's a lot of overlap in terms of some of the services that they provide. There's a lot of health coaching theory and framework, something that in our certification programs we do teach. And this does help give us a better understanding of the complexities of behavior change and what it takes to assist people with behavior change. Again, it would be really nice if we could just give them information and tell them what to do, but it's not how it works. The motivational interviewing approach is congruent with all of these theories and models. It's a communication approach. It's been studied for over 40 years. It's collaborative, it's goal-oriented. It's, again, a communication style with particular attention to the language of change. And what we want to do is help people strengthen their motivation and commitment to a change goal. And we do that by helping to pull out and explore their own arguments for change. That's really important in MI. If you're not evoking change talk, you're not doing motivational interviewing. And right now, it doesn't mean that other health coaching approaches can't be effective, but this is the only one that's been fully described and fully studied and associated with improvements in patient engagement as well as clinical outcomes. So why do we use motivational interviewing? Well, right now there's over 1,800 clinical trials. There's at least 5 meta-analysis showing the efficacy in healthcare. One study where I was involved, we increased enrollment over a typical program by 4-fold. It's the only health coaching approach that's supported by validated and standardized assessment tools. We have 6 of those. It provides structure. There's engaging, focusing, evoking, and planning tasks, which helps the clinician stay on task, on target. It's the only approach that is associated with these multiple published outcomes that can be reproduced, and it's being taught right now around the world in over 52 languages. In terms of building proficiency in MI and health coaching, we generally recommend an initial comprehensive training. This can either be online or it can be in person. It's nice if it ends with a standardized patient. That's what the SP is, a standardized patient activity. So people can get some feedback on their actual skill set and be assessed. It does require, if you want to become proficient, ongoing assessment and feedback. This is a complex skill set, like learning how to speak a foreign language or play a musical instrument. And so you can definitely learn strategies in that initial training, but if you want to be proficient, it takes monthly assessment and feedback reports until you get up to proficiency, and then we find we can move people to quarterly. Continuing education, just like any other field, there's advanced health coaching topics, peer learning, and feedback, and it can be really helpful for a community to discuss scenarios. For non-clinical health coaches and community health workers, if we're putting them into the clinic setting, after they've received this basic training, it is important for them to receive additional training based on the role and the function that they're going to take in the clinic, the population they're serving, the targeted health topics. And so this could be in diabetes management, it could be in smoking cessation. We definitely want them to understand how to advocate for patients, how to provide resources and referrals, and especially how to address social determinants of health. The certification program at UT consists of 2 programs. First, becoming certified in motivational interviewing, and then taking the chronic condition and lifestyle management program, which has a health coach track. The MI program is asynchronous. You can take it at your own pace, at your own time. It's online. It's very interactive. It's 10 to 12 hours, 6 modules. There are practice activities that you do with a partner, and these can be done with any colleague, and they're done anyhow you can communicate. So it can be Zoom, in person, it can be over the phone, and there is that standardized patient activity that we use as a competency assessment and a chance to get personal feedback. The chronic condition course is also online, interactive, and asynchronous, also 10 to 12 hours. It has 4 modules. It provides a lot of resources, websites, and other places to get information in Tennessee. And the competency assessment is a case study. There's more information on these programs, including fees, and we do try to give steep community discounts for partners that we work with. We also have some scholarship opportunities for individuals that don't have an organization to cover them. And you can go to this website and you can see more about the program and also how to register. We've also put together for organizations that need help in looking at, well, how would I get started in hiring a health coach, in training them and getting them up and going, like how would I look at to evaluate if the program's working or not. And so we do have a health coaching toolkit on our website, and it's free to the public. You're welcome to go. And we also have sustainability, which is billing codes that reimburse for these health coaching types of services. And we're going to have, Ashley's going to speak to this at the end, but next month we have a whole learning collaborative session devoted to this topic. Well, we're at the point where I would love for us to share our health coaching experiences. And I'd love to call on Lucy Baldwin first. If Lucy can get unmuted and share with us. I just asked her to share a little bit of her experiences, kind of how she got motivated to get her health coaching certificate and what she's done with it. So I really appreciate. And Lucy, can you just tell them a little bit about where you work and your background?
Sure. Thanks, Susan. So I am a social worker at UTHSC Health here in Kingsport, Tennessee. So I come in with some of this motivational interviewing background, but this was a fantastic opportunity to not only refresh and renew those skills, to get it kind of a little added expertise, but then also to do the health coaching certification and just get more information there. One thing that's a little bit unique about our program, we are a residency training program. So I provide direct patient care, but also work with medical residents and then learners from lots of different disciplines. So behavioral health, pharmacy, we of course have nurses, we have medical students, so a wide variety of providers here in addition to our faculty members. So my motivation, as I say, was just, that further skills development, the information that I knew I could learn, so that I'm not always looking over at one of our physicians and saying, okay, wait, remind me which diet you think is best before I go in and meet with this patient. So it was a great opportunity to have that expertise. Susan had also asked me just to touch briefly on my experience going through the program. I thought it was really well done. I thought, especially the motivational interviewing training, was the fact that it was self-paced made it really easy for me to adapt it to my work schedule. Some weeks I had time to sit down and really give it a full hour at a time. Some weeks I had, 30 minutes during lunch here and there. So it was nice to be able to pause it, come right back to where I'd left off. I also really liked that it was cumulative information. It did a great job of starting with a large overview, but then kind of breaking it down so you're building your skills module by module. I learn well that way, so that was really helpful. To have partner exercises was really helpful as well. I am fortunate enough to have other behavioral health colleagues who are willing to practice with me and give me that direct feedback. But of course, through the program, you can be matched with someone else to do that as well. So that was really nice. I really liked the health coaching program as well. It's set up a little differently. It's kind of one larger module that you work through sequentially. So I was able to kind of just take those kind of piece by piece, topic by topic. But that was really helpful as well. And then also the way it's summarized with a true example patient. Where would you start? What would you say? Would you not say? So I thought that was really helpful. The way that I'm applying these skills here in our clinic, again, is maybe a little different than some other settings. Clearly, I'm got opportunities to use these directly with patients, and I'll speak to that in just a minute. But also because we have so many learners here in our clinic, there are lots of opportunities as I'm sitting with a medical resident and a faculty member, as they're talking through their direct patient care, what they're doing. I'm always now asking, okay, what's the motivation? What's the motivation? And helping them remember this is such a key piece as they're crafting a treatment plan with the patient. Is this something that's doable? Is this something the patient's able to do and motivated to do, or do we need to adjust and adapt it? I also am using these skills. We have medical students who rotate through our clinic, and one of my responsibilities now is to sit down with them at the beginning of their rotation, review motivational interviewing with them. They've already been taught it in their med school curriculum. So we have a, about 20-minute review, and then they have the assignment of using these skills while they're with us for about 4 or 5 weeks. And at the end, I sit down with them, ask them to present a case and talk about not only how that went from the patient's perspective, but from their own perspective. What were the challenges they faced? What did they really find that came easily? What was more difficult? Just so that as they go into their professional career, they have this mindset and this developing self-awareness. Finally, Susan asked me just to kind of share one brief case study. One of my favorites that I refer to quite a bit is I was asked to please touch base with a patient who has been smoking for many years. And as we all know, if you say the word smoking, most people in the room are going to say motivational interviewing. So I went in to meet with the patient. The patient was really kind of at that pre-contemplative stage, maybe contemplative stage of smoking cessation. And they really started talking more and more about their own anxiety. And as we're talking about their anxiety, they then share that they are drinking highly caffeinated soda throughout the day. That's the only beverage they drink. And so we were able then to talk about caffeine and how that can increase your heart rate, that can, have a physical response to the caffeine. So while the patient was not really ready to stop smoking at any level that day, they were very open as we explored their motivation to, well, maybe 1 out of every 3 drinks, I'll use flavored water. And so I kind of chuckled with the medical resident who was seeing this patient. I said, okay, I realize we're not at your end goal yet, but we're on our way. And sure enough, one thing that we were able to experience with this patient is they returned to the clinic. So instead of us coming up with this great smoking cessation plan that they were never going to go home and do, they heard us engage with them about what was really driving what was on their mind and what was driving their motivation to continue smoking. So I think just that patient-centered, patient self-efficacy piece, the patient motivation piece was really important. And one thing I stress with, particularly with our medical students, is this is our opportunity to build and maintain relationships with patients. And that is how we're going to, with the patient, affect a long-term behavioral change to benefit their overall health. And I see there's a question about what perspectives did the med students have on the importance of extra clinical care in general. If you can tell me a little bit more about what you're asking in terms of extra clinical, I want to make sure I'm answering the right question.
Yeah, I just mean care in this environment. So anything that occurs outside of the primary care setting.
Oh, okay. Yeah, so I mean, I guess in our primary care setting, we are part of that setting. So this is all integrated there. So
I guess I'm right now. So beyond the four walls of the clinic, then I guess, I mean, basically what we're talking about here, community care management.
Sure. Yeah. So I'm not sure our medical students, we really didn't talk about that as much. We really talked about just how they can use it in their own practice, and then how we can connect. I'm a social worker, so I'm always talking about how to connect patients to resources, so that I feel like that's sprinkled into every conversation I have with med students. So they're familiar with that. That's how we operate here as well.
That question popped into my head as well. Since motivational interviewing isn't, that may not be how it's modeled in our clinical rotations for us by people who have been in practice for a really long time or how you're used to talking in regular conversation. And I just wondered how they perceived it, or was it difficult for them to kind of switch the ways that they spoke, or did they like it, or what?
I can't speak to other medical schools and how that training goes. So I can only speak to the UTHSC med students the Quillen students we have here. Part of their training is through a communications class where they do talk about motivational interviewing and other communication techniques. So they came in with that knowledge already and with that expectation of how we communicate and relate to patients. I suppose I'm very fortunate in that's really how our faculty here interact with not only patients, but how they expect others to as well. So I think maybe I'm not the best to fully answer. Susan may have other examples where she can address that some.
Yeah, and Lucy, that was a fantastic case study that you shared, just a perfect example of how, if we're patient-centered, we kind of never know where we're going to go that day. But what a fantastic opportunity to help them address their anxiety. And I can just say that I know that multiple medical schools and nursing that I'm working with have increasingly started to develop their curriculum and build on their curriculum in meaningful ways in motivational interviewing. It's not, where we would like it yet, but definitely across the country, there is much more recognition of the importance of teaching, a communication class or having at least motivational interviewing sprinkled in through the curriculum. So it's definitely happening for sure. Thank you so much. Any other questions for Lucy before I turn it over to Vicki? So Vicki Maxwell, would love to have you share your experiences with us if you're still willing.
Yes, thank you for inviting me. One of the questions you asked is what motivated me to go for my certification. My job is patient health manager, and along with that, I do a lot of chronic care management, which involves calling clients monthly, talk to them about lifestyle changes that can be made to better their outcomes. So you take the big triad is high blood pressure, diabetes and hyperlipidemia. You see those three regularly. And ETSU offered to pay for this. So I was like, wow, you know, I love training, I love school, and the opportunity to get to have this additional training at no cost to me was something I had to jump on. I thought that I was like Lucy, I thought that being able to come and go, because I'm constantly getting called into the clinic. I'm a client's here, they want to talk to me in person, or I had a patient that just got released from hospice. They wanted me to add to my care list. So that was added at lunch today. So it's not that I'm constantly tied down to my computer. I have to come and go. And this program was doable. It was something that you could leave, come back to, and pick right back up, which was very helpful. The biggest change I've made with my job, where I've done chronic care management for so long, and clients that I call monthly, I have a close relationship with and a good rapport. I would start off, you know, a conversation. Hi, it's Vicki. What do you need for this month? You know, is there anything I could do for you this month? That type of thing. And one thing I gathered from the training is, you know, that's kind of rude, disrespectful of the client's time. And I've changed the way I introduce myself. I'm still Vicki, but do you have time to talk today? Every time I call clients, I give them that autonomy of being able to pick a time instead of it being selfish and Vicki time. I know I have a job to do, but their time is valuable too. So I try to be more respectful to my clients now. As far as case study, like Lucy's, mine was a smoking cessation patient. She had sat on the fence and was in pre-contemplation for some time. And her husband got diagnosed with a cardiac disorder. And when that happened, she jumped from pre-contemplation into action. It's like she skipped those other steps and she was ready to quit. So we moved on and we talked about a stop date and try to make a plan. She said she wanted to stop cold turkey, which she was successful in doing. So not only did she stop, but her husband had stopped. So it was really beneficial to both of them to be able to quit smoking and partner together to encourage each other.
Oh, that's a fantastic case study, Vicki. That must have been a lot of fun to work with. One of those fun roller coaster rides, because they really jumped on quickly. And
yeah, you hear the change talk, and she just goes from, okay, I'm going to do this.
Yes,
whoa.
yes, fantastic. Well, I see several other people on the webinar that are certified as health coaches or do health coaching. I'm wondering if anybody, I'm not going to put you on the spot, but if anyone would like to share either a case study, an experience you've had in health coaching, an aha for you, even challenges or skills that you're still working on, would love to have you share with the group.
Well, while we're waiting, we do have a question, maybe from those who have shared so far, or maybe if you want to pop off mute and answer. To what extent do you see a family, friend, close community diagnosis of cancer to be a major motivator for smoking cessation? That's a great question. Does anybody have a thought there?
I spent a lot of time in wellness centers, wellness programs and health management programs where we were more in the preventative stage. So most of our clients were, you know, started out in the pre-contemplation, contemplation. They had not received a cancer diagnosis. And so we had to look for other motivators, other motivation for change. They all had them. But the cancer diagnosis, I mean, clearly in Vicki's case was for her, you know, very compelling. Did anyone else have anything to share in terms of that's more in the clinic based, where you are working with people with cancer diagnoses?
I was going to say, you know, what we do know about fear, right? Fear can be a really powerful motivator, but it doesn't last. So that's why we don't want to use you've got to quit smoking. You know, it's going to kill you, right? Everybody knows that smoking is not good for you. We all know that. And I know we had somebody mentioned at the very beginning, what was it, correct information or misinformation. So I've had kind of on the opposite side of that, I've had patients to say, everybody I know who has quit smoking got cancer. I've had that also with diabetes. Everybody I know who started insulin had an amputation or went on dialysis. So I've had those types of conversations in kind of speaking through that as well, to where you have those associations in your mind.
Yeah, I was just going to comment. Jim Bailey here is a general internist and very part-time health coach. Is those times when you bring a new diagnosis to patients and you inform them, whether it's diabetes or early kidney damage, you know, or cancer, I think are sort of there are times for gentleness and sort of also sacred times, but where I think the direct answer to that person's question is that a cancer diagnosis, I think we do see that a lot. And I think there's data to support that people do make a lot of changes when they get a new diagnosis. But I really liked what Ashley was saying, that that's not a great, you don't want to be the one trying to augment their fear, right? People have enough fear on their own when they get that new diagnosis of diabetes or of cancer. You want to give them truthful information, but I think that is a time where the motivational interviewing approach can be really powerfully brought forward, to say, you know, I know you've just learned this news that I'm certain is worrisome to you. You know, what is, you know, what do you think are the most important next steps for you? It is a time where I think we often see people make big changes, and even stick with them. Has that been other people's experience?
To what extent have you seen individuals have a significant motivation derived from somebody close to them, as you know, the example we just heard, getting a diagnosis? So it could be a family member, it could be a friend, somebody in the community. We've seen a lot of evidence for that for breast cancer diagnosis, driving people in the community to go and get their screening done. I'm just curious as to whether you've seen that for smoking as well, or anyone's seen that.
I'd love to hear from others. I certainly have seen that. That's been consistent with my experience. What others?
I was going to say, yeah, I think that is consistent. And Peter, I think in the area that we probably have not, and I'm saying this anecdotally because I have not seen the literature, the area that we have not seen it is in vaping and in younger patients, because it's consistently still rising. It's, you know, like hiding the behaviors. And then a lot of where it was like really, really dangerous that we saw it, it looks like, oh, well, they were using the off-brand cartridges and things like that. So like teenagers, 20s, that it's very social. It's still very social, and it doesn't smell. So that's not uncool. It is pretty uncool to be smoking right now. And we legislatively, like, you don't go out and eat and have a smoking section anymore. But the vaping, we're not doing a great job there.
Hi, my name is Tanya, and I am the manager of Ballad's Tobacco Cessation Program. And just to coincide with what you just said, Ashley, we do see our smoking middle-aged people kind of rise up in support of a spouse. Recently, we had a gentleman who reached out and asked for assistance because his wife had stage 4 cancer. And she previously smoked, and in support of her, he was reaching out for that assistance too. And he has just been phenomenal in his progress, and has since stopped. And it was really miraculous for him. Now, that's not always the case, but our program in particular is completely telephonic. And so it is nice to see, I would say probably 10 to 15% of our patients, we do encourage them to have that support, in the home. And so we have them set up to do little couples sessions. So we kind of knock it out together, and we really encourage that they support one another in that goal setting and that sort of thing. So we've had tremendous success in that.
Tanya, thank you for sharing that. Social support can be so critical to people's success. I'm wondering if others have any health coaching strategies that you've used that have worked for you. Those of you that have become certified, again, we're interested in any of your experience or advice to others that are thinking about it. And we can also open it up just for general questions as well. Feel free to use the chat. We're a small enough group today. Feel free to just speak up. Any questions at all about health coaching, about the certification program, any other topics that you find interesting today?
So we've got Vicki Maxwell says that she finds dietary changes and exercise exchanges come easier with a client that has a health buddy. I totally agree with that. Like in the diabetes education sections in DPP, for instance, it's almost impossible if you're cooking, 2 different meals or 4 different meals, those types of things. So I try to have those conversations. If anybody has strategies or have found themselves in those similar situations, we'd love to hear about that.
And we talk a lot about social media in terms of some of the harms and the risks. But I do know that there are people that have found social support when they can't find it amongst family or friends. There are people that can find social support for lifestyle changes on social media in support groups. I don't know whether anyone's had a chance to provide that for your clients or patients. Other questions or comments? I do want to make sure Ashley has a few minutes to talk about some upcoming topics in the next couple of months. And also, if you have any requests for topics, putting them in a chat would be a great assistance to us. It sounds like smoking cessation might be, we've visited that in the past, but it might be something for us to revisit. Ashley, you want to go ahead and talk about some of our upcoming topics? And then again, please use the chat function if you have suggestions as she's talking.
Sure. First of all, I'm going to put my email address here in the chat. If anyone has any questions, comments, requests, things like that, I would love for you to reach out directly. I wanted to share with you all a few updates that we have with our learning collaboratives going forward. So we've got 4 tracks. Our tracks are addressing social needs, patient engagement, and health coaching. So that's the track that we're in today. We have patients and caregivers, and then we have the pharmacist physician collaborative. So you'll see those with some of the branding. We have logos for each and where they will be located on our resources page on the website. So you'll be able to look at those webinars that would be of interest to you or to refer to other people. So one, we would love to have your help in growing our listserv. We would also, if you've got a speaker that you think would be great, even if it's somebody that you see like at a national conference or something, and you're like, I would love to have seen that, or I think they were great, please send them to us, and we'll reach out and see if they can speak for us. So the ones that we have coming up in March, we have coding and billing updates for health coaches and pharmacist sustainability. So we've worked really hard over the past 3 years to have some codes available for all of you health coaches to bill to our 10Care MCOs, and you can get paid for your work doing these kinds of things. So we're looking forward to explaining the FAQs, how to do it. We've tested these claims, and we want to make sure that you have a sustainable business model going forward. So that's going to be March 6th at 12 Central. So if you're interested in that, please register, and that will be Dr. Cy Huffman and me going through that, and it'll be an open session much like this with questions and answers. And then on 3/26 in the evening, we have a patient and caregiver session, and that's going to be about promoting patients' use of the EHR. And then we will have Susan again presenting part of the primary care toolkit and how practices can add a health coach to their team. So that's kind of our March lineup that's coming up, and that one is available for CE. That's the American Academy of Family Physicians, the Tennessee chapter. So we've got lots and lots of great stuff. So if anybody has any questions or anything like that, please let us know.
Well, I really appreciate everybody's participation and discussion today. I think we'll be able to grant you the gift of 8 minutes back to your day today. But again, feel free if you have any ideas and future discussion to reach out to Ashley. But thank you so much for being here today, and a big shout out too for Lucy and Vicky for sharing their experiences with us. I found it very interesting and helpful.
Thanks, everybody. Hope to see you soon.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee, and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.